see ankle.
Down, set, 51, 52, hood, hike.
Hello, this is Dr. Hartman from Westwood-Mansfiled Pediatrics. Today we're going to talk about ankle sprains and what to do about ankle sprains. The majority of ankle sprains, even when somebody is not weight bearing, can be handled at home without having to go to an emergency room. Obviously, football season starting, so that's where you can see ankle sprains. Soccer will be beginning too. Biggest sport for ankle sprains is basketball. And so basketball is probably the biggest place where we see ankle sprains, for example. And what happens with an ankle sprain is people jump and they twist their ankle like this. And they stretch all these ligaments. That's called an inversion injury. This is called eversion. That one warrants an immediate assessment within the first, actually, 24 hours. This one, when you twist this way, is the common one that we see all the time. Remember the term RICE. Rest, ice, compress, and elevate. Here's all the equipment you need to do that. Bag of peas, compress with one of these devices, and you may have to walk with crutches for a time period, and you can elevate your foot as well to keep the swelling down. You can take some Motrin, ibuprofen, Advil, or Aleve for pain. So now we're going to look at the anatomy of the foot and the ankle. Again, remember, the foot twists inward like this, and what happens is these three ligaments, 1, 2, 3, get pulled in varying degrees. It's called the triradiate ligament, and some will tear, and that causes the swelling under here and the pain as well. Now, in girls that are usually over 14 and boys that are usually 16 or older, your growth plate, the red spot, is closed. So there's no concern that these ligaments can pull the growth plate and separate it a little bit. And to be frank, an X-ray may not show the separation of the growth plate. In fact, often doesn't. And it's more clinical, where there's either tenderness across the growth plate, or a child has had an ACE wrap and things aren't improving. In fact, they may be getting worse within 5 to 7 days afterwards, after wrapping, icing, and elevating. And that's often the times when we suspect what's called a Salter 1 type fracture. And again, these are kids that are oftentimes prepubertal. They can range from 7, 8 years of age to up to 16. For girls, it's more like 14. For boys who growth plate close later, about 16. So these are the ligaments that get pulled, and that's why we have to compress to reduce the swelling and ice the area as well. So, in conclusion, number one, when your child has a sprain, immediately ice it and wrap it and elevate it. You can get crutches with instructions. If the instructions seem unclear to you, give our office a call. You can give a swelling of an ankle 7 to 10 days and the pain 5 to 7 days, unless it's significantly worsening over time. Remember, ibuprofen or Aleve. Follow our instructions. Kids that are 12 and older can easily take 2 adult strength Aleve or ibuprofen as well. This is Dr. Lester Hartman from Westwood-Mansfiled Pediatrics, proactive in your child's care, empowering families for over 50 years. And we hope this saves you a trip to the emergency room and keeps your child healthy. And as always, call us with any questions. Have a good day and a great fall and spring and winter sports season and summer with no injuries. Bye now.